And our next speaker is Dr. Bal Pawa, and she's a physician with a focus on integrative medicine and women's health. She obtained certification in mind-body medicine at Harvard Medical School, and she's also a certified menopause clinician through the North American Menopause Society. As a clinical instructor at the UBC Faculty of Medicine, she continues to inspire and mentor young physicians. And today she will be speaking on the role of a dysregulated nervous system as a primary source of inflammation and chronic disease, the role of emotional state on physical health. The floor is yours, Dr. Pawa.
Thank you. It's been a wonderful conference so far. Thank you. And because of integrative thinking, we have to think about integrating the mind and the body. These are seamless systems. And we need to integrate more of the mind and how the emotional state affects the physical state. So I'm just going to share some of my slides here. And hopefully you can see this. Is it showing up? Okay, share. Okay.
Yes, we have it.
Great. Okay, so psychology profoundly impacts biology, and many of us who've got some medical background know about the hypothalamic pituitary adrenal axis, and that's our stress response. So stress, it has been around for as long as human beings have walked the earth, and we need the stress response. So there's acute stress and chronic stress. So acute stress, our body can handle it, our biology can handle it, and it's very resilient. But when that stress becomes chronic, then it starts to impact even the organ that created the stress, which is the brain. It can impact the brain through inflammatory pathways. So I want to show you how the nervous system, the autonomic nervous system, it's a very complex apparatus of hormones. It's a neuroendocrine organ. And we sort of left the autonomic nervous system to the devices of medical doctors. And I wanted to bring that to the masses, because if I could help people regulate their emotional state, I could regulate their neurological state and thereby help to regulate their physical state. When I realized that 75 to 80% of the symptoms that are showing up in a doctor's office can be attributed to chronic stress, I felt so compelled. That's why I did a lot of research and I wrote a book on this, because we are treating a pill, a pill for every ill. It's very much an intervention model. But if you look at the model of a dysregulated autonomic nervous system, you start seeing almost all illness is stress related, sometimes caused by stress, sometimes aggravated by stress, and sometimes the illness itself causes more stress. And if you look at chronic disease, the Lifestyle Institute of Chronic Disease and lifestyle medicine in North America, you look at many conditions that 70% of them are attributed to chronic excessive stress hormones. And when you look at a stressed mind, we as doctors always tell people eat properly and exercise and go to bed on time. Those are three very wonderful lifestyle interventions. However, if we don't fix the mindset, we're not going to get the health outcomes, because the mind is ultimately what changes behavior. It's what makes your choices and decisions. So we have to spend a little more time to analyze how that person is making his choices and decisions. So the autonomic nervous system is a very complex system, but let's just keep it simple. There's the parasympathetic and the sympathetic. Sympathetic is like the gas pedal. It revs up your body, you get increased heart rate, increased blood pressure. It changes the blood flow to your gut. It helps you to run away from the saber-toothed tiger. The parasympathetic is called rest and repair, or rest and digest. And it's a state of homeostasis or regulation where your body is into growth and repair. Sympathetic is called fight or flight. So when your stress is short-lived, fight or flight, your heart rate, blood pressure, all your biological systems handle it. Your systems are integrated. But we need a system to stress is automatic, but relaxation is not. We need to teach people how they can actually access more of the parasympathetic response because of the covert stressors today. If you look at the pandemic as an example, it was global stress. And what did it do to our biological systems? So, how do we access and consciously provide the relaxation response? And this is research done at Harvard. And they looked at two groups. They looked at Wall Street um, stockbrokers who are mostly living in adrenergic overdrive sympathetic nervous system. And they also studied Tibetan monks. And they were able to see that once we are able to exercise conscious control over our mind is inextricably linked to the nervous system. So if we taught people to do biofeedback, meditation, then we could actually bring them into the parasympathetic mode. What we do know is that prolonged stress hormone overload increases the inflammatory load. We see increased catecholamines, we see cortisol going higher. We just saw the last speaker speak about cortisol and its relation to blood sugar. If you think about it, you're running away from a tiger, you want sugar in your blood to be able to have that energy capacity. And then, of course, cortisol is related to insulin resistance, high cholesterol, the immune response is affected, and even your diurnal variations, sort of the circadian rhythms are impacted. And when you heard about the cytokine storm or cytokines and inflammatory markers, we can actually see biological changes with chronic stress. So, inflammation actually is the root cause of most disease. We can all agree on that. But inflammation, we don't connect the dots. 85% of our immune system is actually located in the gut. So, when you think about a dysregulated autonomic nervous system, it actually impacts the normal function of the gut. Decreased blood flow, decreased secretions, decreased peristalsis, and even secretion of various digestive enzymes. So, when you have chronic inflammation, you have to look at what kind of psychosocial stressors are going on in that body and how it's impacting their gut. Most often, people will complain of heartburn, IBS, inflammatory bowel disease, and it impacts the microbiome as well, because that is where our 85% of our immune system is located. And if you look at the chronic diseases that we're treating now as physicians, the rate of autoimmune diseases is astronomical. Arthritis, these are wear and tear arthritis, and also the rheumatoid, cardiovascular, diabetes, mood disorders. Just in the last 1 year, if you look at the burden on healthcare, not due to direct COVID results, but if you look at the effect that the pandemic had on our stress levels, the number of sleeping pills, anti-anxiety, antidepressants, they all went up. So we know that our body directly reacts to stress, but what we're doing now is the current model is intervention. And what we're hoping with integrative thinking and voices from the trenches, our doctors who are seeing this every day, day in and day out, is to take a different approach to looking at it from a prevention model. This is Dr. Benson at the Harvard School. He's retired now, but he is showing that diagnostically we could never measure stress, but now we can look at functional MRIs and they can see the blood flow changes in stressed brains versus meditative brains. They can see that traumatized brain, PTSD, it actually changes the structures in the brain. You get the cingulate gyrus gets enlarged in somebody with PTSD. So we now have objective diagnostic criteria, which we didn't have 30 years ago. I've been in practice for 30 years, and we could never really objectively measure stress. We can measure neurotransmitters a little better. We're still working on the science on that. We can measure the HPA axis with the cortisol pathways more. So I think in our lifetime, we will see better diagnostic capacity to measure an individual stress, which is very, very unique to that person. Now, the conventional way to reset the nervous system, we usually, I call it name it, tame it, name a disease, we tame it with a drug, and then we blame it because often we get iatrogenic side effects from the drug. Every action has a reaction. So these are some of the prescription drugs that have been prescribed in North America. The data shows these are the top prescribed drugs. And that's what we see when patients come in. They're often on many, many different drugs. What I am proposing, and in the book, The Mind Body Cure, some of you have had the copy, is to think of a different way that we can use to reset the nervous system. What if we taught patients tools? We know that they have an innate ability to heal themselves. We know that the father of medicine also supported that theory that all of us have natural forces inside us, and we're not harnessing the power of the individual by using their mind to help prevent disease. So I formed an acronym called the Reframe toolkit, and you're all welcome to it. If you email me, I'll send you a PDF of this, and I can send you my slides as well. But first, we start with resetting the nervous system, and that is through controlled breathing, meditation, yoga. So you reset the nervous system biologically, physiologically. Secondly, you exercise. Of course, that burns off cortisol and adrenaline. Food, the food we choose. Assessment and awareness. Awareness is the agent of change. And as physicians, I really feel that it's important to make our patients aware of what power they have and how much power their thought patterns have over their health, and help them to connect the dots. I had a gentleman who was using a lot of inhalers. And I said, why are you suddenly using a lot of inhalers all of a sudden? What happened? He said, oh, I joined a course and I have this big exam, and then my girlfriend broke up with me. And so we start teaching them that psychosocial triggers are related to their physical illness as well. And the mindset, resilience is the opposite of stress. How do we cultivate resilience? And teaching people resiliency quotients. And the last but not least is the examination. It's very important to go and see your doctor, because not all disease, some diseases are mild, moderate, and severe, and you still need to have the intervention model, but let's put a lot more focus on the prevention model. And I'll entertain some questions now. I hope I stayed in time, Jesse.
Thank you very much for that great presentation. We do have a question. You talked a little bit about the importance of gut and gut health, and we also see over time that we're hearing more about the microbiome and antibiotics and how it has wiped out our microbiome, et cetera. Do you see that these type of interventions, or what the impact of this type of intervention is on people that have very, very, poor gut health?
Yes, there's a very profound gut-brain connection. It's a bidirectional flow between the gut. And these bacteria are not just good bacteria for good bowel movements, but these bacteria actually have a cell signaling theory that communicates with neuroendocrine signals through our brain, and it's very bidirectional. So in my lifetime, I never thought I would hear psychiatrists say that they are now using certain probiotics to help with mild to moderate anxiety and mood disorders. So if you look at most psychiatrists, they are looking at polypharmacy, not just one SSRI, not just one anti-anxiety pill, but they're now prescribing 2 or 3. But some of the integrative psychiatrists have said, no, let's look at lifestyle, let's look at exercise, let's look at the gut microbiome. And I think that is a really revolutionary thing that we should be looking at.
Thank you so much. We do have a couple of other questions, but